Question 1. A client receiving lithium 900 milligrams per day develops coarse tremors, confusion, and vomiting after a recent dose increase and dehydration from gastroenteritis. What is the nurse's priority intervention? A. Stop lithium, initiate IV fluids with normal saline, and notify provider. B. Encourage oral fluids and continue monitoring. C. Administer antiemetic and recheck lithium in 24 hours. D. Withhold lithium until symptoms resolve. Answer. Stop lithium, initiate IV fluids with normal saline, and notify provider. Rationale. Lithium excretion decreases with dehydration. Symptoms suggest severe toxicity, requiring IV fluid support to promote renal clearance. Question 2. A client on warfarin after valve replacement presents with new-onset headache, ecchymosis on arms, and IN are 7.2. What should the nurse do first? A. Stop warfarin and prepare IV vitamin K. B. Notify provider and give acetaminophen for headache. C. Administer oral vitamin K and continue therapy. D. Assess for other bleeding sources before acting. Answer. Stop warfarin and prepare IV vitamin K. Rationale. An IN are greater than 7 with neurological symptoms may indicate intracranial bleed. Immediate reversal is life-saving. Question 3. A client on phenytoin for seizure control is admitted with unsteady gait and nystagmus. Serum phenytoin level is 28 micrograms per milliliter. Which nursing action is most urgent? A. Hold dose and notify provider immediately. B. Administer activated charcoal. C. Reduce next dose by half. D. Increase IV fluids. Answer. Hold dose and notify provider immediately. Rationale. Toxic levels greater than 20 micrograms per milliliter cause CNS depression. Early intervention prevents respiratory compromise. Question 4. A client receiving IV vancomycin rapidly develops flushing, pruritus, and hypotension. The provider insists to finish the dose quickly. What should the nurse do? A. Slow the infusion rate and inform provider of possible Redman syndrome. B. Follow the provider's order and complete infusion. C. Stop infusion, flush line, and report adverse event to pharmacy. D. Continue infusion with normal saline bolus. Answer. Slow the infusion rate and inform provider of possible Redman syndrome. Rationale. Nurses must advocate for safety. Rapid infusion can cause anaphylactoid reactions requiring rate adjustment, not compliance with unsafe orders. Question 5. A client on digoxin and furosemide reports seeing halos and has HR42 BPM. Potassium ion equals 2.8 milliequivalent per liter. What is the priority nursing action? A. Hold digoxin, replace potassium, and notify provider. B. Give digoxin and recheck HR in 30 minutes. C. Administer antiemetic for nausea. D. Start cardiac monitoring but continue meds. Answer. Hold digoxin, replace potassium, and notify provider. Rationale. Hypokalemia potentiates digoxin toxicity. Both drugs must be held until electrolyte correction. Question 6. A client on gentamicin and vancomycin for sepsis develops a rise in creatinine from 0.9 to 2.4 milligrams per deciliter in 24 hours. What action is most appropriate? A. Stop both antibiotics and notify provider. B. Increase IV fluid rate. C. Continue therapy and recheck labs in 12 hours. D. Administer sodium bicarbonate. Answer. Stop both antibiotics and notify provider. Rationale. Both drugs are nephrotoxic. Rising creatinine signals acute kidney injury, requiring immediate discontinuation. Question 7. A diabetic client on metformin undergoes a CT scan with IV contrast. What should the nurse do before the procedure? A. Hold metformin 48 hours before and after the procedure. B. Administer with food to reduce GI upset. C. Give insulin concurrently. D. Increase oral fluid intake. Answer. Hold metformin 48 hours before and after the procedure. Rationale. Contrast-induced nephropathy can precipitate lactic acidosis with metformin. Withholding drug prevents fatal toxicity. Question 8. A client taking spironolactone and lisinopril reports weakness and palpitations. ECG shows peak T waves. What should the nurse do first? A. Notify provider and expect order for sodium polystyrene sulfonate. B. Encourage increased dietary potassium. C. Continue both medications. D. Start IV fluids with potassium chloride. Answer. Notify provider and expect order for sodium polystyrene sulfonate. Rationale. Combined ACE inhibitor and potassium-sparing diuretic cause dangerous hyperkalemia needing immediate treatment. Question 9. A post-op patient on PCA morphine is found unresponsive with RR6 per minute, SpO2 82%. What is the priority action? A. Stop PCA and administer naloxone IV. B. Increase O2 flow rate. C. Call rapid response without intervention. D. Check pain score and sedation scale. Answer. Stop PCA and administer naloxone IV. Rationale. Respiratory depression is life-threatening. Naloxone must be given before other actions. Question 10. A client on isoniazid for tuberculosis reports numbness in extremities and fatigue. Labs show AST 160 units per liter. What is the nurse's best action? A. Stop medication and notify provider. B. Continue therapy and add vitamin B6. C. Encourage high-protein diet. D. Reduce dose by half. Answer. Stop medication and notify provider. Rationale. Elevated AST suggests hepatotoxicity, not neuropathy alone. Requires discontinuation to prevent liver failure. Question 11. A client receiving furosemide, IV 80 milligrams, complains of ringing in the ears. What should the nurse do immediately? A. Stop infusion and notify provider. B. Administer slower over 15 minutes. C. Reassure that it's temporary. D. Check potassium level. Answer. Stop infusion and notify provider. Rationale. High-dose IV furosemide can cause ototoxicity. Stopping infusion prevents permanent damage. Question 12. A client on amiodarone develops cough, dyspnea, and crackles. Chest X-ray shows infiltrates. What should the nurse anticipate? A. Discontinuation of amiodarone due to pulmonary toxicity. B. Increased dose for rhythm control. C. Administer corticosteroids. D. Begin incentive spirometry. Answer. Discontinuation of amiodarone due to pulmonary toxicity. Rationale. Chronic amiodarone use can cause fatal pulmonary fibrosis. Immediate cessation is needed. Question 13. A client on long-term prednisone therapy for lupus is scheduled for surgery tomorrow. Which pre-op order requires clarification? A. Hold prednisone on the day of surgery. B. Monitor blood glucose preoperatively. C. Continue stress dose steroids. D. Monitor for delayed wound healing. Answer. Hold prednisone on the day of surgery. Rationale. Stopping steroids abruptly before surgery risks adrenal crisis. Must continue perioperatively. Question 14. A client receiving clozapine reports sore throat and fever, WBC 2500 per cubic millimeter. What is the nurse's priority action? A. Stop medication and notify provider immediately. B. Encourage oral fluids. C. Give acetaminophen for fever. D. Schedule next CBC in 7 days. Answer: stop medication and notify provider immediately. Rationale: clozapine-induced agranulocytosis poses life-threatening infection risk. Immediate discontinuation is required. Question 15. A client on heparin infusion for DVT has PTT greater than 150 seconds and reports back pain. What should the nurse suspect? A. Retroperitoneal bleed. B. Pulmonary embolism. C. Dehydration. D. Hypoglycemia. Answer: retroperitoneal bleed. Rationale: back pain with prolonged PTT indicates internal bleeding from heparin overdose. Question 16. A client prescribed nitroglycerin patch for angina reports severe dizziness after using sildenafil the same morning. What is the nurse's immediate priority? A. Remove patch and place client supine. B. Encourage fluids. C. Monitor HR only. D. Continue nitroglycerin with oxygen. Answer: remove patch and place client supine. Rationale: combination causes severe hypotension. Stopping nitrate and supporting perfusion is critical. Question 17. A client newly started on levothyroxine develops anxiety, tachycardia, and insomnia. TSH equals 0.02 microinternational units per milliliter. What is the appropriate action? A. Notify provider to reduce dose. B. Reassure symptoms are temporary. C. Withhold medication until TSH normalizes. D. Administer beta blocker. Answer: notify provider to reduce dose. Rationale: suppressed TSH indicates excessive thyroid replacement, risk for cardiac events. Question 18. A client on atorvastatin and erythromycin develops muscle pain and dark urine. What is the nurse suspect? A. Rhabdomyolysis due to drug interaction. B. Normal drug reaction. C. Biliary obstruction. D. Electrolyte imbalance. Answer: rhabdomyolysis due to drug interaction. Rationale: erythromycin inhibits STAT metabolism, leading to muscle breakdown and renal failure. Question 19. A client on metoprolol and insulin reports dizziness and diaphoresis, but denies palpitations. What complication does this suggest? A. Masked hypoglycemia. B. Hypotension. C. Medication tolerance. D. Hyperglycemia. Answer: masked hypoglycemia. Rationale: beta blockers blunt hypoglycemic warning signs like tachycardia. Requires careful glucose monitoring. Question 20. A client on amphotericin B for fungal infection reports chest tightness, fever, and rigors during infusion. What is the nurse's immediate priority? A. Stop infusion and assess airway. B. Continue infusion and document. C. Administer antihistamine and monitor. D. Notify provider after completion. Answer: stop infusion and assess airway. Rationale: although mild rigors are common, chest tightness may indicate anaphylaxis. Requires airway management first. Question 21. A client receiving IV phenytoin for seizure control has a serum level of 28 micrograms per milliliter and reports double vision and ataxia. What is the nurse's priority action? A. Notify the provider immediately. B. Slow the infusion rate. C. Document and continue monitoring. D. Flush the IV line with NS. Answer: notify the provider immediately. Rationale: toxic phenytoin levels greater than 20 micrograms per milliliter can cause severe neurotoxicity and cardiac arrhythmias. Immediate provider notification and holding the dose are essential. Question 22. A client on clozapine reports fever, sore throat, and chills. What is the most critical nursing intervention? A. Encourage hydration. B. Obtain a CBC with differential. C. Administer acetaminophen. D. Continue medication with monitoring. Answer. Obtain a CBC with differential. Rationale. Clozapine can cause agranulocytosis. CBC confirms neutropenia, which requires discontinuation to prevent life-threatening infection. Question 23. After initiating IV nitroprusside for hypertensive crisis, the nurse notices confusion and hypotension. What should the nurse suspect? A. Cyanide toxicity. B. Hypoglycemia. C. Fluid overload. D. Drug tolerance. Answer. Cyanide toxicity. Rationale. Nitroprusside metabolizes into cyanide. Signs include altered mental status and hypotension. Infusion must be stopped and antidote. Sodium thiosulfate administered. Question 24. A diabetic patient on metformin is scheduled for a CT scan with IV contrast. What action should the nurse take? A. Continue metformin as ordered. B. Hold metformin before and 48 hours after contrast. C. Administer insulin instead. D. Monitor capillary glucose hourly. Answer. Hold metformin before and 48 hours after contrast. Rationale. Metformin with contrast eye increases risk for lactic acidosis and acute kidney injury. Withholding prevents renal complications. Question 25. A client taking digoxin reports nausea, blurred vision, and yellow halos around lights. The pulse is 48 BPM. What is the nurse's next step? A. Give the next dose with food. B. Hold the medication and notify the provider. C. Recheck the pulse in 15 minutes. D. Administer an antiemetic. Answer. Hold the medication and notify the provider. Rationale. Signs indicate digoxin toxicity, especially with bradycardia. Medication must be held to prevent cardiac arrest. Question 26. A client on gentamicin reports hearing loss and dizziness. Which assessment is most critical? A. Serum creatinine. B. Temperature. C. Blood glucose. D. BUN. Answer. Serum creatinine. Rationale. Aminoglycosides are nephrotoxic and ototoxic. Elevated creatinine suggests renal impairment requiring drug adjustment. Question 27. During IV vancomycin infusion, the client develops flushing and hypotension. What should the nurse do first? A. Stop the infusion immediately. B. Notify the provider after infusion. C. Administer diphenhydramine and restart infusion. D. Document and continue. Answer. Stop the infusion immediately. Rationale. Red man syndrome from rapid infusion causes histamine release. Stop infusion and treat before restarting at a slower rate. Question 28. A client on warfarin has an INR of 7.2 with minor gum bleeding. What is the nurse's immediate action? A. Administer vitamin K as ordered. B. Hold the next dose and recheck INR. C. Continue the dose and monitor. D. Administer protamine sulfate. Answer. Administer vitamin K as ordered. Rationale. INR above 7 increases hemorrhage risk. Vitamin K reverses anticoagulation and prevents serious bleeding. Question 29. The nurse gives morphine 4 milligrams IV to a post-op patient. 10 minutes later, the client's RR equals 8 per minute. What is the priority action? A. Reassess in 5 minutes. B. Call a code blue. C. Administer naloxone. D. Place in Trendelenburg position. Answer. Administer naloxone. Rationale. Respiratory depression is a life-threatening opioid side effect. Naloxone reverses opioid-induced respiratory suppression. Question 30. A client taking spironolactone reports muscle weakness and irregular heartbeat. What lab finding would confirm the nurse's suspicion? A. Sodium 130 milliequivalent per liter. B. Potassium 6.2 milliequivalent per liter. C. Potassium 3.1 milliequivalent per liter. D. Calcium 8.0 milligrams per deciliter. Answer. Potassium 6.2 milliequivalent per liter. Rationale. Spironolactone is potassium-sparing. Hyperkalemia can cause arrhythmias and requires immediate intervention. Question 31. A client receiving amiodarone reports cough, dyspnea, and chest pain. Which complication should the nurse suspect? A. Pulmonary toxicity. B. Heart failure. C. Bronchitis. D. Anxiety. Answer. Pulmonary toxicity. Rationale. Amiodarone can cause life-threatening pulmonary fibrosis. Any new respiratory symptom warrants immediate discontinuation. Question 32. The nurse prepares to administer insulin glargine and regular insulin in one syringe. What is the correct action? A. Mix them together in one syringe. B. Administer separately. C. Give glargine first, then regular. D. Give regular first, then glargine. Answer. Administer separately. Rationale. Glargine must never be mixed with other insulins. Mixing alters absorption and can cause hypoglycemia. Question 33. A client on isoniazid INH reports numbness in hands and feet. What is the most likely cause? A. Vitamin B6 deficiency. B. Liver toxicity. C. Medication allergy. D. Diabetes neuropathy. Answer. Vitamin B6 deficiency. Rationale. INH interferes with pyridoxine metabolism, causing peripheral neuropathy. Supplementation prevents this side effect. Question 34. The nurse notes tardive dyskinesia in a client taking haloperidol. What is the most appropriate action? A. Increase the dose. B. Discontinue the drug and notify the provider. C. Add benztropine. D. Reassure the client's symptoms will resolve. Answer. Discontinue the drug and notify the provider. Rationale. Tardive dyskinesia is an irreversible extrapyramidal side effect. Medication must be stopped immediately. Question 35. A patient on furosemide presents with weakness and flattened T waves on ECG. Which lab result should the nurse expect? A. Sodium 145 milliequivalent per liter. B. Potassium 2.8 milliequivalent per liter. C. Calcium 10 milligrams per deciliter. D. Chloride 100 milliequivalent per liter. Answer. Potassium 2.8 milliequivalent per liter. Rationale. Loop diuretics cause potassium loss, leading to hypokalemia and dangerous arrhythmias. Question 36. A client taking rifampin reports red-orange urine and tears. How should the nurse respond? A. Stop the medication immediately. B. Reassure that this is a harmless side effect. C. Notify infection control. D. Advise increased fluid intake. Answer. Reassure that this is a harmless side effect. Rationale. Rifampin causes harmless body fluid discoloration due to metabolite excretion. Question 37. A client on lisinopril develops swelling of the lips and tongue. What is the priority intervention? A. Notify the provider. B. Administer epinephrine. C. Apply cold compresses. D. Hold the next dose only. Answer. Administer epinephrine. Rationale. Angioedema is a life-threatening reaction to ACE inhibitors requiring immediate epinephrine administration. Question 38. A client on methotrexate for rheumatoid arthritis reports oral ulcers and bleeding gums. What lab value should be reviewed? A. AST or ALT. B. WBC count. C. Platelet count. D. BUN. Answer. WBC count. Rationale. Methotrexate causes bone marrow suppression leading to leukopenia, thrombocytopenia, and mucositis. Question 39. After giving IV potassium chloride, the patient reports burning at the IV site. What is the nurse's best action? A. Stop infusion and assess site. B. Dilute the infusion further. C. Reassure it is expected. D. Flush with saline. Answer. Stop infusion and assess site. Rationale. IV KCl can cause phlebitis and tissue necrosis. Stop immediately to prevent extravasation injury. Question 40. A client on heparin drip develops sudden flank pain and hematuria. What is the nurse's immediate action? A. Stop the infusion. B. Reduce the rate. C. Call urology consult. D. Give protamine sulfate. Answer. Stop the infusion. Rationale. Flank pain and hematuria indicate internal bleeding. Stopping the infusion prevents further anticoagulation while preparing antidote administration. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.